how is scleroderma treated? Well, this is the interesting part. Scleroderma, there is no one thing that will completely push down the immune system and make this disease go away. It's not like one of those autoimmune diseases. In fact, everything is treated as it comes up. And some of these problems need autoimmune medications, some need other medications like heart medicines or stomach medicines, etc. And some things are just scarred, so they don't really need medication, it's just natural scarring. The one thing about scleroderma patients that has to be taken into account is that we try not to use too high a dose of steroids because it seems the very high doses of steroids, especially in those diffuse scleroderma patients, can cause that renal artery spasm and kind of tip them into a renal crisis that then becomes a medical emergency. Now, how do these scleroderma patients do long term? Well, the answer is it depends. It depends on what subtype they have, how much of the disease they have, and where it is. And by far, we do know that what really predicts how well a scleroderma patient will do depends on how much disease they have in their hearts and their lungs. However, it's a little bit tricky sometimes because some of the symptoms are the same in either disease. And this is where it's really important for the doctor to know what subtype they are dealing with. So, to give you an example, if I have a limited scleroderma that is very short of breath, I need to look at their heart and maybe have them start heart medications. However, if I have a diffuse scleroderma who is having shortness of breath, then look at the lungs and they may need some autoimmune medication. So this is important so that the patient is treated the right way. As Hippocrates himself would tell his medical students, especially when it came to treating diseases in their patients, to make a habit of two things: to help or at least to do no harm.